This year's flu strain is said to be especially problematic. In Saskatchewan, vaccination rates have lagged behind other provinces, and we've seen a spike in flu cases across Canada over the December holiday break. To get a sense of what's happening here in the province, we're joined by Saskatchewan's Chief Medical Health Officer, Dr. Saqib Shahab. Good morning, Doctor.
Good morning, Adam.
So, Doctor, what can you tell us about the flu situation in Saskatchewan at the moment?
Well, this year the influenza season started right in the middle of winter. As you know, last year we had a very late flu season. Flu didn't start till February. But this year it started right in the middle of winter. Cases started picking up in November. They peaked over the holidays. The last CRIS report, influenza test positivity was 40%, which is fairly high. Usually we go up to around 30, 32% most years. And right now, our latest CRIS report, which went online yesterday, shows an influenza test positivity of 38%. So what it means is that if we have a cough and cold and fever, it's most likely influenza right now.
What's the difference between this year's flu strain than last year? What do we know about this, Doctor?
Well, every year we can see three different flu strains going around: H3N2, H1N1, and a B strain. The flu vaccine actually protects against all three. Um, Last year was different because we had A and B strains going around together towards late winter, early spring. But usually, what we see is what we're seeing this year is that we see the A strain go around first, and this year it is the H3N2 strain, and then we likely see another spike, a lower one, with the B strain around February, March. It's important to remember, though, that the World Health Organization predicts which strains should go into the vaccine for the northern hemisphere. They have to make that prediction as early as February 2025 for this year's vaccine, and so that the vaccine can start getting produced. And so while the vaccine covers all three strains, there was some concern in the UK in October. They had an earlier start to the flu season, that there was a slight strain variation in the H3N2 that is going around the UK due to a case subclade, and they were concerned about vaccine effectiveness. But since then, the UK and other European countries that had an earlier start to the flu season have confirmed that the vaccine effectiveness is actually fairly good. It's moderate, and that's usually the case when we have H3N2 going around. So I think the bottom line is people who already got themselves vaccinated October, November, that's great. You have, the vaccine will help you getting seriously ill and will prevent hospitalization in the majority of cases. But if you still haven't gotten vaccinated, and that's especially important for children 6 months to 5 years, anyone with an underlying health condition, women who are pregnant, and everyone over the age of 65, there's still time to go and get the vaccine.
What are our vaccination rates like here in Saskatchewan?
Well, our vaccination rates for the last few years have been more or less the same. In fact, right now, our vaccine uptake is almost identical to last year. Overall vaccine uptake is 20%, so 1 in 5 Saskatchewan residents is vaccinated. On a more positive note, if you look at vaccination rates over the age of 65, it's about 53%, so that's good. So people are going and getting the vaccine. Most people get vaccinated in October, November, which is the optimum time. But we've seen a slight increase in vaccination rates even in December. And again, there's vaccine available, and if you are at high risk, do plan to get it vaccinated.
What has this 40% infection rate, as you mentioned earlier, with the flu? What has that done to our hospitalization numbers here in Saskatchewan?
Yeah, so first of all, if you look at the rate of infection, it's highest as always in young people, school-age children, university students, because they are out and about the most. So every third, fourth household has a child who's been ill with the flu. So that is very common to see respiratory viruses impact young people more. But you're absolutely right. Hospitalization is a risk that's higher in people who are older. Now, you can see hospitalization in any age group, and that's what we're seeing this year with influenza. and that's especially if you have an underlying health condition. But hospitalization is more common in people who are older. And of course, something that we always work very hard to control is outbreaks in long-term care facilities, because again, residents in long-term care facilities are usually elderly, they are frail, they have many health conditions. They're the first to get vaccinated in October. They get the high dose or the adjuvanted vaccine, which is designed for seniors and elderly, but still, because they are older and frail, they still can have a greater impact from influenza, even if vaccinated. So we continue to see a high number of outbreaks in long-term care, and that's why it's really important for us to not visit a long-term care facility if we ourselves are ill, and if we are visiting, to follow all the guidance that's there, like sanitizing our hands, wearing a mask if we're asked to, and only visiting the resident we want to visit, especially during an outbreak situation.
And doctor, is this flu behaving any differently than others? Are people reporting worse symptoms, or are they sick for longer? Are there any differences there than in years past?
Well, H3N2 strain, usually, of course, children under the age of 5 usually have less immunity, because they haven't, many children under 5 haven't been exposed to influenza yet. So they can have, more children can get influenza. And then elderly H3N2 can sometimes be more severe. Obviously, vaccination reduces the severity. Beyond that, I think most provinces in Canada, Western Canada, Central Canada, and other central provinces, we all saw influenza come at the same time, picking up in November, and the increase in case numbers was very, very rapid. And that is typical of influenza, especially in years when the strain may have a lower population immunity. Beyond that, I think our hospitalization numbers so far are similar to what we would expect to see at the height of the influenza season. And we still have 6 to 8 weeks to go before influenza season will start settling down.
Doctor, really appreciate your time this morning. Thanks so much for joining us.
Okay, thank you very much. Always a pleasure.